Good morning, everyone. Thanks for attending today. My name is Nicole Sinderman. I am a program manager with the Missouri Department of Health and Senior Services Tobacco Prevention Control Program. In addition to the statewide telehealth option with Baby and Me, our program has partnered with Baby and Me to offer this service in person at health departments in Butler County, the city of St. Joe, and Stone County. And we've been able to add this service thanks to a significant increase in state funding into Department of Health and Senior Services to expand tobacco prevention and cessation services. You might wonder why Missouri Department of Health and Senior Services has an entire program dedicated to tobacco control. The burden of tobacco use is quite high in our state. Missouri is one of 13 states included in Tobacco Nation. These states share higher tobacco use, worse health outcomes, and residents of these states spend a higher percentage of their disposable income on tobacco. The national smoking rate is about 11%, but some rural counties in our state have a rate of nearly 30%. Tobacco use and exposure remains the leading cause of preventable death, disease, and disability in Missouri. Smoking causes more deaths each year than HIV, illegal drug use, alcohol use, motor vehicle injuries, and firearm related incidents combined. And over 12% of mothers in our state report smoking during the last 3 months of their pregnancy. Children from rural and low income backgrounds have higher exposure to secondhand and thirdhand smoke. And we know that nicotine is a very addictive drug, and most people want to quit and they try to quit. Half of Missourians who use tobacco try to quit each year. Our state policies and the tobacco control environment in Missouri contribute to the high rates of use we see in our state. We are one of the few states that does not have a smoke free air law. The Missouri Clean Indoor Air Act has many exemptions, allows for designated smoking areas indoors. It even allows for smoking in daycares if children are not present, which exposes children to the toxic residue from third-hand smoke. Smoke-free laws and tobacco-free environments are really the foundation of reducing tobacco use. Smoke-free environments help people quit. They prevent youth from starting tobacco use by changing the social norm, and they encourage the adoption of voluntary smoke-free homes and vehicles. We also have the lowest sales tax in the country at only 17 cents a pack. These two things contribute to the high rate of use in our state. And the good news is that we know what works in tobacco control. We know that smoke free policies, raising the sales tax for tobacco products, hard hitting media campaigns, and cessation access are the four foundational evidence based strategies that drive down tobacco use and exposure. All of these strategies have been proven to reduce tobacco related death and disease, reduce exposure to secondhand smoke, reduce youth use, and help people quit. The Baby and Me program is one of the ways we are increasing access to evidence based cessation in our state. And with that, I'll turn it over to Alyssa Williams to tell us more about the Baby and Me tobacco free program.
Awesome. Thank you so much, Nicole. And thank you so much, Rachel, for giving me the opportunity to talk to you all today and that great intro at the beginning. As Rachel mentioned, my name is Alyssa Williams. I'm the Director of Health Services for the National Office of Baby and Me Tobacco Free. I'm going to talk to you today. This is kind of our overview of what we're going to cover. I want to give you a little bit of background about kind of us as a best practice, evidence-based program, and then really kind of get into the meat of things when it comes to, what does the program entail? What's the eligibility? I'll talk about our physical site implementation and also our telehealth implementation, since we have two modalities here in which we're offering the program to pregnant people in Missouri. And then I'll specifically speak to the referral process and then materials that may be available to you following the webinar today. I would be remiss if I didn't, of course, thank the Missouri Department of Health and Senior Services, Nicole's Division in Tobacco, and also Ashley Otto through the Maternal and Child Health Division at the state. Both of them are funding the two modalities of our program that are being implemented statewide in Missouri. So just a little bit of background about our program. We have been around for a really long time. We are an evidence-based intervention with a public health reach. We not only help pregnant people quit, but we also extend into the postpartum period as well, and also address tobacco use within the home. And we'll talk a little bit more about how we do that here in our program. We are an AMCHIP, Association of Maternal and Child Health Programs, best practice, and we've been designated as such since 2017, something that we're really proud of. It can be really difficult to get that designation. Our program that kind of falls in line with that evidence-based model has been published 3 times in scientific journals, twice in the Maternal and Child Health Journal, and once in the Public Health Nursing Journal, showing that the outcomes of our program are successful. And those outcomes being number one, that we are an effective smoking or tobacco treatment program. That's number one. Number two, we have been proven to increase uh, positive birth outcomes among the pregnant people whom enroll in our program. And then also, Public Health Nursing Journal not only highlighted those birth outcomes, the positive results, but also that the states and or agencies and those who use their funding and dollars to invest in this program get a really solid return on investment, or ROI. So we're really proud of those journal releases, and we'd be happy to share those with you following the webinar. So, requirements and eligibility for the program. Anyone who is pregnant, of course, you do have to be a Missouri resident. That probably goes without saying. But just as a reminder for this implementation, we are in Missouri. You have to be pregnant less than 36 weeks gestation, based on that protocol, is because of the length of which they're in the program, kind of how our structure is. You'll see that here in a few moments. When it comes to tobacco use, our pregnant participants have to meet one of 3 criteria. They either have to be current tobacco users, they could have quit any time during their pregnancy, or they could have even quit within 3 months before that pregnancy, before becoming pregnant. It's really important for us to still capture those women who may have planned for their pregnancy and in preparation for that, quit. And we'll talk a little bit more about why that's so important. As part of the Baby and Me program, while we are very much focusing on our pregnant population, and those are the ones in which we enroll and kind of do our curriculum based on, we also have a what we call a support partner protocol as part of our program. And that's where we call them support partners, someone, it can be anybody, but they have to live with the pregnant participant. They can also enroll alongside that pregnant person if they are using inhalable tobacco products. So we want to make sure that we're trying to address second and third hand smoke exposure within the home. We know that being around those in the household that use tobacco is a really high rate, causes a really high rate of relapse, especially in the postpartum period. So if a household smoking support partner is eligible and willing, they can enroll alongside that pregnant person. Our program is based on 3 core essential elements, and they are the same for physical and telehealth implementation with a little bit of nuances. So, I'm first going to talk specifically about our physical sites in Missouri. Nicole mentioned we have one in Butler County, St. Joseph City, and then also in Stone County. We also have a fourth in Perry County. I'll show you where they're located here in a few moments. But those 3 pillars, kind of core essential elements of Baby and Me, are counseling, testing or biomarker feedback, and then incentivizing. We have a contingency management pillar component of our program. When we talk about counseling, kind of the specific details on that, we do conduct one on one counseling. It is very intensive counseling tailored not only to the pregnant population, but to each individual person that enrolls in our program. And it is so intensive because we are dealing with a very specific population that requires, based on evidence and research in tobacco treatment, needs a more intensive approach. So that's why we do that one on one. We have 4 prenatal sessions, so those occur during pregnancy, and then 6 to 12 postpartum sessions, which occur about once every month after baby is born. It's 6 to 12, depending on kind of the specific protocol of the implementation. Sessions are obviously in person for our physical locations, and they last about 15 to 25 minutes in length on average when it comes to the counseling component. Biomarker feedback or testing for tobacco use, a really important part of our program. We test our participants at every visit, every time to verify their tobacco status. So, not only for enrollment, but also as they progress in the program, we are able to see that they are quitting. And not only us and our facilitators can see that, but they can see that progress too. So, it really acts as an important motivator for them. We use carbon monoxide monitors as our primary form of testing. It's a multi user unit that our health departments get to use on every participant. We also utilize saliva tests as alternate backup method in any case where maybe a CO level result that we get isn't what we would expect. And also in the case of any e-cigarette use and also smokeless tobacco. So e-cigarette use and any smokeless tobacco, oral products, those tobacco usage methods don't show up on CO Monitor. So that's why we use both forms of testing. So we cover our basis because we enroll pregnant participants that are using any form of tobacco. Our incentives, these are gift cards that we hand out at prenatal and postpartum sessions in the state of Missouri. If they are tobacco free, they receive an incentive at prenatal session 3 and 4, and then also at every postpartum session. And again, they do have to be tobacco free to receive that incentive. These gift cards are actually restricted gift cards that can only be used to purchase diapers and or wipes at Walmart stores or online. So a very specific targeted incentive for the people who are enrolling in our program, which is really makes it unique. Since we're still on that topic of physical enrollment sites, here are where our physical locations are located within their counties. Again, you'll receive my presentation today, so you don't have to memorize this or write it down. You'll receive these slides and you can look to see if you serve or have any eligible pregnant persons who can enroll in the program and you would like to refer them to these health departments, this is where they would go. So, really stay abreast of where these are located because we want to support our physical enrollment locations first. And then, of course, if you're serving pregnant persons outside of these areas and they can't be served by these health departments, then we could serve them via telehealth. Which is rolls right into talking more specifically about the telehealth implementation. Telehealth is statewide. So, again, if you have clients or are serving this population and they're outside the realms of those physical health departments, they can still receive these services because we conduct the telehealth, obviously, via telephonic and video chat. We have really the same structure when it comes to counseling, still one on one. We still have those 4 prenatal. Telehealth recipients receive 6 postpartum virtual sessions. And again, our sessions still remain the same length. The only difference is they're done virtually. And just like our physical enrollment locations, we also test for tobacco use at every visit, every time. CO monitors are still our primary form of testing. In this case, however, we don't have a handheld multi user unit. Instead, every enrollee who joins the program receives their very own personal carbon monoxide monitor. It actually pairs with their phone, pairs to it's Bluetooth, pairs to an app, and they talk together. The app has facial recognition software, and that's how we're able to get those testing results because we also have back end dashboards and access anytime they set up an ICO with their own personal device. Again, we also use saliva tests for the e-cigarette and also smokeless tobacco if we need an alternative method as well. And of course, we send those to our participants just like we send our CO monitors. Incentives also the same. Only difference is instead of a physical restricted gift card, they receive a digital gift card. We actually call them vouchers in our program, but same dollar value. Still for diapers and wipes, it just is sent digitally. Like if you were to receive, an email with a gift card for your birthday or maybe another holiday. It works exactly the same. But again, restricted use only for those two items in store or online at Walmart. More specifically on the incentives, because that usually is a really exciting part of our program that we get a lot of questions about. As I mentioned, pregnant participants and also their support partners receive incentives in our program when they test tobacco free. So it really acts as a motivator to help them along their journey of reducing tobacco and then fully maintaining cessation at the end of their prenatal period and then into the postpartum period as well. A pregnant participant enrolled in our program is eligible for up to $400 in vouchers or those restricted gift cards. Support partners are eligible for a little bit less, about $300 in vouchers. And that's because they don't start receiving incentives until the postpartum period. For our pregnant participants, they have to quit a little bit more quickly, if you will, right? We want to have our biggest impact on their health of them and their baby. And so they do have to be quit by the end of their prenatal period in the program. Support partners, they're not pregnant, so we give them a little bit more time. They also enroll usually a little bit later in the program, so they don't receive that incentive till postpartum. So really, if both individuals enroll together, they have the potential to earn $700 in vouchers. So that's for baby wipes and diapers. We know that they will need them. We know that this is not only a great motivator in helping them quit, but our research shows and does a lot of the data out there that those who can afford tobacco the least tend to use tobacco the most. Upwards of 85% of our participants nationwide do receive Medicaid services, and so we know that finances are usually a huge barrier for them. So not only will they save money in quitting, but we're also helping them with a commodity that they really need during this time as they welcome a newborn baby. I'd be remiss if I didn't just take a step back here. I know we've been talking about the pregnant population, and we obviously all know how important it is that our pregnant people quit using tobacco and stay quit. But it's so unique for our program to be doing it during pregnancy because pregnancy is really such an ideal window for any tobacco user to consider a quit attempt. Upwards of 50% of pregnant people will actually quit as soon as they find out they're pregnant. That is huge. And we see that in the research. We also see it in our data. About 50% of the women who enroll in our program have already quit. As soon as they find out they're pregnant, we call them spontaneous quitters. They immediately say, I know that using tobacco is not good for me. It's not good for baby, and I'm going to quit. But we still enroll those women, right? If you remember our eligibility criteria, because relapse postpartum is so incredibly common. Once they reach 6 months postpartum, upwards of 80% of women will return back to tobacco use. And so, again, an ideal window, they're more likely to make behavior changes because, again, they're pregnant. And so they are not only looking out for maybe themselves, but really focusing a lot of their time and energy and thoughts. And a big, huge motivator is baby. So, really just a great opportunity for us to get them in tobacco treatment. There are really 3 easy steps to screen for tobacco use, and we call this brief intervention. And so, hopefully, all of you, whatever entities that you are at, whether that be health departments or some other type of health or social service program, or service, you're hopefully asking the clients and the people who walk through the door, hey, are you using tobacco? And advising them to quit. A lot of times we talk about the 5 A's, which is it's still brief tobacco intervention, but it takes a little bit longer. When it comes to the fact that you all have access to our program statewide, you really can take the 5 A's and decrease them down 3 steps: ask, advise, and refer. So you should be asking any adult tobacco user, but in our case, any adult or maybe teen pregnant person Are you currently or were you recently? Because again, we can enroll people who have recently quit. Are you currently or were you recently using tobacco, including e cigarettes and vapes? That's a really important distinction, a little tack on the end of that ask question, because I mentioned we enroll any type of tobacco user, and many times the culture of tobacco is changing. Right, we hear a lot more about e-cigarettes and vaping, heated tobacco products, and those are included in our program. And a lot of times, those who use those products, if you say, "Do you smoke? Do you use tobacco?" they might tell you no. They don't consider themselves to be smokers. So, including that little verbiage at the end of your question is really important so that we can capture anybody who might be eligible to receive Baby and Me services. You would then advise them in a very clear, consistent, personalized manner. I need to let you know that quitting tobacco, any form of tobacco, is one of the most important things that you can do for your health and the health of the baby. Are you willing to give quitting a try? Again, we're using a little bit, if you're familiar with motivational interviewing techniques, right? Kind of giving them the autonomy, asking them, would you be willing to make a quit attempt? And if they are, you can then refer them. Talk a little bit about the program, right? I've given you some really overview of what the program entails, what they can expect, and just letting them know there's a program that we can refer you to that can help you. Sometimes mentioning the incentive, right? It's just that little carrot, if you will, to kind of maybe push them from being ambivalent about changing, just kind of over the edge to saying, yeah, I want to give this a try. Let's go for it, right? Go ahead and refer me, and let's see what the program is all about. So that can also help. This is scripting. Again, you'll receive these slides. You can make it your own. Don't have to go verbatim, but remembering the ask, advise, refer steps for screening for tobacco use is going to help you and help us enroll more pregnant people. So when it comes to referring, how do you go about doing that? When it comes to submitting a physical site referral, you're actually going to, if you are located in one of these counties within kind of the geographic area, or maybe you can refer to that area if you are close by or kind of across county lines, you're going to contact those agencies directly to inquire with them as to how they receive referrals. Again, our physical enrollment locations listed here on this slide versus the last one. I have here our main contacts and their phone number and email address. And of course, if that changes, we can let you know. But the really great thing about having a physical enrollment or implementation modality is that these health departments get to fit Baby and Me inside their internal processes, kind of the work that they're already doing at their health importance, their important work, right? And so we give them the autonomy of however you want to receive referrals. Do you do fax? Do you have some type of internal system, right? What does that look like? And so we leave it up to them and their good judgment to implement the program, whatever is best and whatever is feasible for them. So reach out to them. Also inquire, do they receive outside referrals? Right. Some of them may stay a little bit more internal in terms of the clients they specifically serve. But again, reach out to these contacts. They're such amazing folks who do such great work. It's been a privilege for me to work with them. When it comes to telehealth, obviously we have a little bit more of a streamlined process that we've had to develop in order to make sure that we reach Missouri residents. So if you would like to submit a telehealth referral, again, you are not at means, or a participant is not at means to visiting in person one of our physical sites, you would first go to our babyandmetobacco-free.org website. Once you get there, at the top right-hand corner of the screen, there'll be a little button that says submit a referral. You'll click on that. You'll be brought to a listing of states, agencies, sites, etc., that implement our telehealth model and or utilize our referral system. Of course, you're going to click Missouri, and you can choose the agency referral link a form will pop up, a referral form, and you're just going to complete that one-page form and click submit. And then we, our telehealth counselors, we call them facilitators in our program, both in person and telehealth, will respond to a referral within 1 to 3 business days. So we are very quick to making sure we can serve your clients. I'm going to play a really brief video that just kind of walks you through how easy it is to visit our website and submit those telehealth referrals.
To submit a referral online, go to the Baby and Me Tobacco Free website at babyandmetobaccofree.org. Click Submit a Referral at the top of the page. Scroll down to your state and select Submit an Agency Referral. Complete the program referral form. Fill out the sections in program eligibility, client information, and referring organization information. Once complete, click Submit, and we will follow up with that woman in 1 to 3 business days. A pregnant woman can also refer herself to the program by clicking on a self-referral link and selecting Click Here. She'll complete a self-referral form and fill out the sections in program eligibility and personal information. Once she has completed her form, she'll click Submit, and we will follow up with her within 1 to 3 business days as well.
Okay. So as you can see, very simple, very easy. In this video, of course, you saw that Camille, a member of our team who created this great video, she did click on Colorado, but hopefully you saw Missouri there. It was kind of on the left-hand side. Very, very same process. And like in Colorado, you noticed first she walked you through, okay, if you're an entity, a health department, WIC, et cetera, and you're a provider, right? Any type of provider providing services for our population, and you're directly submitting that referral, what that looks like versus we do in Missouri and the telehealth modality also allow for pregnant persons who are eligible to refer themselves. And so that is also an option too. We, of course, always encourage provider referrals. Those women tend to do best. They tend to have higher enrollment rates, stay longer engaged in the program. And that's because we know that the great work that we all do with this population, our encouragement, our advisement of them quitting, following back up, kind of closing that communication loop, makes it more powerful, makes it more likely that not only will they make a quit attempt, but that they will be successful. So again, we have the self-referral option, which is absolutely great and wonderful, but those direct referrals from all of you is really important. I just talked about closed loop communication, and so it would be amiss for me to kind of follow up with, once you send a referral, kind of what happens from there. You will automatically receive an email from our referral system that will tell you we've received your referral, it's complete. And you can see an example of that, exactly what it would look like here on the left-hand side of the screen. And you'll notice here also in a blue kind of rectangular box, I've highlighted what's titled National Referral ID. So every pregnant person who is referred to our program gets their very own unique referral ID. And so that is what's going to be placed in the email, of course, in lieu of any other identifying information, right? Everything that we do with our program, which I'm sure with all of yours, HIPAA compliant. And so that is a way for you to keep track, if you would like, as to what happens to those referrals once you send them to us. Because on the flip side, once we change the status of a referral, so you can see here on the right-hand side of the screen, that this same referral ID, the NR-04911, new status, enrolled in program. So every time we update what we call referral status, you'll actually receive an email regarding that update. So if you would like to keep track, again, of the clients that you refer, you don't have to by any means, then you could create some sort of system, okay, in this case, on February 13th, I referred Jessica Smith, and that same very day, wow, only moments later, that counselor was on the ball. She was enrolled in the program. And we have a listing you'll receive from Rachel, in addition to my presentation, another resource for you called a referral guide. And in that guide, you'll see a listing of kind of predefined referral status options that we have created for the program that you can expect to see. So once you submit that referral and we change that status, what might we change it to? Many of them are self-explanatory. Client not eligible. We contacted them. They refused the program. They told us they were no longer interested. Unreachable. We utilize up to 3 attempts to contact our referrals. And if we don't reach them, at that point, then we'll mark them as unreachable. If we need to reopen a referral, scheduled initial appointment means we've got her on the calendar, got her scheduled, and then enrolled in the program means she's completed the enrollment process and is moving forward with one of our counselors, which is hopefully always the goal. So again, you can look at that referral guide to kind of get a definition of each of these, but most of them are pretty self-explanatory. But again, if you want to keep track of what happens to any client you refer, it's a really great idea to do so, because if you happen to see a status such as unreachable, and if you see that person again, you can kind of say, hey, I heard from Baby and Me and they said they couldn't get a hold of you, kind of, what happened? And a lot of times, maybe we can get them to either recommit, or maybe something did happen. They didn't want to answer the phone, or they weren't really quite sure who it was. Their phone number changed, whatever the case may be. Closing that loop again can kind of help ensure that we help as many eligible pregnant people as possible. I have to take a moment to talk to you about one of our amazing, we have several telehealth counselors on our national team. All of us at the National Program Office are tobacco treatment specialists by training. We also have a lot of other great backgrounds in maybe healthcare, social work, public health, etc. The specific telehealth counselor for the state of Missouri is Carrie Evans. She's been with Baby and Me for a very long time. She actually started within a state physical implementation. She actually comes to us from Indiana, and they've done the program in person for some time now. And so she started there and then joined our team and is now a telehealth counselor. So when your clients get a call, get communication and enroll in the program, they specifically will work with Carrie, and they stay with whomever they enroll with. We keep the very same counselor. Again, Carrie is from Missouri. There may be sometimes here and there, right? We're all human. If we're out, we're sick, we're on vacation, etc. But usually, those Missouri residents, they're going to see Carrie, and she's just great. And if you ever have any questions, you can always reach out to her. For telehealth materials, kind of program outreach and promotion, we do have 3 types of promotional materials. We have a referral card, which is basically instructions for you all as to what does the referral process entail. So everything I've just gone through, you can actually get a card printed if you want to give it to other staff within your agencies or within the work that you do. Maybe they couldn't join today. So that's more for providers, more for you all who are working with participants. But we also have 2 other promotional items, a postcard and a poster, branded, of course, with Baby and Me, that are more geared toward those pregnant people. So you can kind of have them out in your agencies, have them hung up so that they can ask about the program or they can get more information. For these materials, if you'd like them printed, you'd like whatever, all of them, some of them, one version of them, you actually will contact Ashley Otto. I have her email address here. Again, you'll receive these slides, so you'll have it. She has the ability for you all to order these materials, and they will get shipped right to you if you so choose. When it comes to our physical enrollment locations, they also have access to Baby and Me branded from us promotional materials. So if you are within, again, a region, an area, that county, and you know that you're going to send clients to those physical locations, please reach out to them so that they can get you their very own personalized materials. Because you can see here, we have the ability to do that. They can put their information in the text boxes. So make sure you reach out to them. These materials have just been rebranded. They're fresh, new, hot off the press, and our in-person sites have our older versions, but they'll get these new versions soon. But they'll be able to help you. They're so great.